Just about every important human disease has some kind of a skin manifestation, and dermatologists are often the ones who have the opportunity to make a diagnosis in a patient. And I always found it kind of exciting to take somebody who was going through a large battery of tests and studies and be able to look at their skin and tell their physicians what the problem really was just by looking.
Dr. Wiley, in his initial visit with me, he was so particularly focused on listening to what I had to say, and when I particularly pointed out that spot on my back that I wanted him to take a look at very carefully because I was here for a second opinion, he looked at it and then he said, "I think we ought to have that removed and send it off to be biopsied."
Every time I see a patient, I have to, no matter what they're coming in for, I have to accept the fact that there may be some time bomb going off that I may be the one person who can find it.
Had I continued to have gone back to my provider and not sought a second opinion, I wouldn't be here today to talk about it.
My family sees how clear I am, and I'm the youngest of four, and because I've had psoriasis since I was 2, they've seen me in all different conditions, so they visually see what a good doctor is doing for me.
You provide good medical care in terms of the totality of everything that goes on with a patient, and that begins from the time they call on the phone to make an appointment to the time that they've left. Having live people on the phone that you can actually talk to a human being is part of that experience. I hire extra staff so that people hopefully are not going to get a curt, quick response on the phone. Someone will actually talk to them and answer their questions.
They put me at ease, and even when Dr. Wiley took me into his office and he sat and listened to me, there was no pressure to see the next patient. He focused completely on me.
I think what excites me now is just most of the people I see I've been taking care of for a long time. They're like family to me. And I enjoy seeing them, and I enjoy touching bases with them. I've developed relationships, and it's kind of like going in to see old friends.
I really feel I have a bond. When I come here, I feel like I've come to my family. I really do. He really, really, really cares.